Hello, my name is Esther Lisinde. This is my innovation project video proposal for DNP U702HP2. It is about using the Monarch University Low Food Map Diet mobile app to help patients with irritable bowel syndrome. What problem will this innovation project solve? This innovation project is to help patients with irritable bowel syndrome. Irritable bowel syndrome is a chronic gastrointestinal disorder characterized by symptoms such as abdominal bloating, gastrointestinal ring, abdominal pain, diarrhea, and constipation. IBS symptoms may also develop following enteric infection. There are no structural abnormalities to explain the IBS pain. IBS is present in 10 to 20% of adults in the United States. The IBS pain is often relieved by defecation. The etiology is probably multifactorial, and evidence suggests motility, inflammatory, genetic, immune, psychological, and dietary components. Researchers point out that it is now recognized that the best way to alleviate IBS symptoms is to avoid foods that contain a family of carbohydrates known as food maps: fermentable, oligosaccharide, disaccharide, monosaccharide, and pollets, which are poorly absorbed by the gastrointestinal tract. With this innovation, we are going to improve communication between the patient and their physician, control their symptoms, change their lifestyle, and reduce physiological stress and other comorbidities caused by IBS disorder. What is known about this problem? In 2015, an expected 1.3% of U.S. adults, that's 3 million, were diagnosed with IBS. This was a substantial increase from 1999, with a 0.9%, about 2 million adults. The human service cost of IBS in U.S. is assessed to about $8 billion a year, and IBS is the most popular reason for referral to gastroenterologists. Some ethnic groups were more likely to report IBS, which include Hispanic or non-Hispanic, whites born in the U.S. compared to those born outside the U.S. Among adults who seek medical help, females outnumber males at a ratio of 2 to 1. Socioeconomic problems have been linked to IBS. According to CDC, individuals with less than a high school level of education, age 45 years or older, who are not employed, living in poverty and in suburban areas, are more likely to report IBS. A history of physical or sexual abuse has been reported in 32 to 44% of patients. Stress and emotional pressure every now and then trigger episode of IBS, in spite of the fact that there are no particular identity profile or mental disorders related to IBS. Patients who do not react to pharmacological treatment may require a referral for a more severe mental medication and support. Hypnotherapy and psychosocial behavioral therapy have appeared to profit patients with unmanageable IBS. Patients with IBS had lower overall gastrointestinal symptom scores while on a low food map diet compared to those on a habitual diet. Patients of the IBS subtypes had greater satisfaction with stool consistency while on the low food map diet. Patients with diarrhea predominant IBS are the only subtype with altered fecal frequency and the King's 2 chart scores. Current treatment for IBS include rifaximin. This has a modest benefit in the relief of global symptoms and bloating in patients with IBS. We can also use lexovodolin to reduce abdominal pain. The role of intestinal microbiota in the etiology of IBS and other gastrointestinal disorders is receiving significant attention. The utilization of new molecular technique to study bacteria has shown that patients with IBS have substantial difference in the microbiota compared with people without IBS. It is unclear whether intestinal microbiota is a cause or an effect. This has led to an increased interest in the use of treatment such as probiotic, prebiotic, symbiotic, fecal transplantation, non-absorbable antibiotic, as well as dietary changes to influence change its microbiota. Our mobile app used to solve IBS problem is the Monash University Low Food Map Diet app. Researchers at Monash University developed a diet and this related app to help manage gastrointestinal symptoms associated with IBS. This mobile app provides users with accurate information about which food may trigger IBS reaction, thereby helping patients to manage their symptoms. The Monash University Low Food App diet works by restricting food that are high in a certain carbohydrate called food maps. Food are listed in the apps using a traffic light system. Red food are high in food maps and should be avoided. Orange food are moderate in food map and may be tolerated by some patients. Green food are low in food map and are safe for consumption. The specific food serving size in the application is particularly helpful in taking the guesswork out of how much food can be safely consumed. This mobile app contains food maps, meal ideas, recipe, shopping lists, journals, as well as a series of variable information about IBS that will help IBS patients recognize and interpret symptoms and how to follow the food map diet. Patients can also use this app to create a graphic representation of their daily symptom status where they can electronically transfer this to their physician before any scheduled follow-up. I have 3 collaborators. Our first collaborator is a certified family nurse practitioner, FMP, and a doctoral student. She is currently working with an inpatient facility dedicated to providing the best patient care and utilizing evidence-based practice research. We select this nurse practitioner because she works and collaborates with an interdisciplinary team of pharmacists, registered nurses, and other fellow providers. She uses and understands the technical, social, or ethical issues inherent in the widespread use of mobile information technology in the workplace. Our second collaborator is also a certified nurse practitioner and a doctoral student. He provides primary and preventive care for patients in several outpatient nursing facilities. We selected this NP because he routinely engaged in an evidence-based practice that includes assessing scientific literature. He uses severe healthcare mobile apps and is able to influence the widespread adoption of mobile information technology. Our last collaborator is a 36-year-old mother of 2 children. She has IBS symptoms. She has been having these symptoms recently, and she has been having a lot of symptoms lately. Her sister is also has similar symptoms but has not seen a physician. We selected this collaborator because her health care can be affected by the adoption of this MASH low food map diet. FMP1 found that low food map app to be useful, user-friendly, and graded the app as A+, and was impressed with its use of red, yellow, or green circle rating system. Another area she thought was useful was the food database that goes beyond individual food items, and she was happy that the university has been testing pre-packaged food from a variety of countries to help IBS patients. She also complemented the comprehensive selection of articles covering all aspects of the diet, many of which offer highly specific tips for ensuring the patient are following a healthy, nutritious food plan. She was happy to introduce the app to her collaborator. FMP2 pointed out that the low FODMAP diet may be an effective one, but it is probably not easy. It will take organization, determination, and discipline to stay on track, at which all with all self-monitoring process, which is required with all self-monitoring process. He loved the weekly shopping list right within the app that exposes patients to purchasing and keeping around the house only healthy, controlled food options. He pointed out that the app's red or green dot were indistinguishably for colorblind user. The colorblind filter setting in the app was not apparent for some users. That was a critical problem with the app. Our solution would be for a clinician to help with the calibration in the app. The IBS patient indicated that this is the first app that goes a long way towards making her diet doable, and graded it as an A+. The participant digestion improved dramatically. She now creates her weekly shopping list right with the app and purchases only low FODMAP food. She found a variety of low FODMAP recipe rich options for snacks as well as her main meal. The patient indicated that she is now using the app to record what she eats and how she feels in the nifty little food of a symptom dieter. All three collaborators believe the pro version of the app was expensive, which was $7.99. After purchasing the pro version that unlocks all meal plans and access to other features such as the shopping list, the collaborators had a change of mind regarding the app's cost. All three collaborators indicated that for some end users, managing security password and code will be difficult, which I do accept. FMP1 advised seeking funding from American Gastroenterology Association. Why is the proposed solution innovative? The mobile app shared the following characteristics of intersectional innovation as described by Johansson 2006. All other collaborators who used this mobile app were fascinated and surprised by its capabilities. The mobile app solution takes the treatment of IBS into a whole new technological direction. The proposed solution embraces an incremental, disruptive, and sustained innovative treatment approach. The first anytime, anywhere technology that reduces IBS symptoms by using a mobile information application based on a unique dietary approach as compared to the standard pharmacological therapy. The mobile app is undoubtedly going to affect both the clinician and the IBS patient in an exceptional way. The mobile app will increase the proximity between the IBS patient, clinician, and other collaborators. This proximity increase is due to the mobile app's capability to provide a rapid and continuous exchange of information between the IBS patient and their clinician. The mobile app is proposing the use of low FODMAP diet, which opens a new field for IBS management. The mobile app will surely generate followers, and this mobile app concept of treating IBS is going to provide a source of other directional innovation vis-a-vis IBS management for years to come. The development of this mobile app is as a result of a flash in the sky serendipity, as described by Johannesson in 2006, that involved creative thinking and the critique of ideas amongst intersectional collaborators at the Monash University to do something different, disruptive, innovative regarding the management of IBS. This concludes our presentation. Thank you for following this innovation project video proposal today, and goodbye.